My name is Mike Schnaubelt. I'm an orthopedic surgeon with BayCare Clinic. My first introduction to the anterior hip replacement technique was when I was in my training about 15 to 16 years ago. I trained with about 50 different orthopedic surgeons in Grand Rapids, Michigan, and one of them did anterior hip approaches almost exclusively. And I just tended to notice his patients recovered much quicker, and we almost never got called in for a hip dislocation with his patients. So that piqued my interest, and more recently the approach has gained a lot of popularity, especially down in the southern part of the states. So I trained with a doctor down in Tampa, and he thought within 5 years this technique would be really the only way people are doing hip replacements because it's such a benefit to the patient and the results are so much better. The approach for an anterior hip replacement is made right in the front part of the hip. Its incision for me, it's about the width of my hand here, and it's just off the bony prominence in the front of the pelvis, and then it goes down at about a 45-degree angle across the front of the hip. And again, it's just about the width of my hand, so fairly small incision, and we don't have to cut any muscle with that approach. We just divide between a muscle plane and open it up almost like you'd open up a book. So the recovery is much easier without having to cut the muscle. With a traditional approach or a posterior approach to the hip, the incision is made more along the back side here, and it tends to be probably about double or longer the length of the incision for an anterior hip. We have to divide or spread the gluteus maximus muscle on the back side, which gives great exposure to the hip. We can really see what we're doing very well, but it makes the recovery much easier, and it's a lot more, it makes the recovery more difficult, and it's a lot more painful since we had to split the muscle. The main benefit of an anterior hip replacement is the shorter recovery. The hospital stay is usually only 1 to 2 days versus a traditional approach is 2 to 3 days. A lot of folks will go home the day after surgery with this technique. The overall recovery is also much quicker. With a traditional hip replacement, it's 2.5 to 3 months for patients to feel like they've fully recovered and can go back to work. With an anterior hip replacement, a lot of people by 6 weeks feel like they've fully recovered and have returned to work. The other benefit is patients are able to usually go right home after the hospital stay instead of going to a rehab type place or a nursing home. I've only had a handful of patients that required a nursing home with this anterior approach because the rehab is so much easier. The rehabilitation after an anterior hip replacement is also much easier. The therapy isn't quite as extensive since we're not cutting any muscle, and it's also much easier, much less painful. The other benefit is we don't have any restrictions on patients after an anterior hip, which is really nice to the patient. With a traditional hip replacement, we can't let patients cross their legs for fear of dislocating, and there's several other restrictions, mainly that we don't have patients bend more than 90 degrees at the hip here or bend forward at the waist more than 90 degrees. And those are obviously very common activities people do every day. So with an anterior hip replacement, you don't have any of those restrictions. The only restriction I put on people is that they don't run or don't jump, and that's true of any joint replacement patient. From a technical standpoint, one of the main advantages of doing a hip from the anterior approach or from the front is that we can get the leg lengths much closer to where they should be. With a traditional approach, the patient is usually lying on their side, so it's much more difficult for us to judge their leg lengths both by x-ray during the surgery and by feel. With an anterior approach, the patient is lying flat on their back, and we can just simply put their legs together at the end of the surgery and judge their leg lengths there, and also get good quality x-rays during the surgery since the patient is lying flat on their back. The other benefit of having good x-rays during the surgery is we can make sure we have the implants exactly where we want them. That'll help the implant last for a longer period of time. If the implants are off even 15-20 degrees, it can severely affect both the stability of the implant and the length of time that it will last.